Hello guys, good morning. This is Miss Henderson. Welcome back to my YouTube channel. Thank you so much for tuning in. As always, to my returning subscriber, thank you so much for your support. Thank you so much for your gratitude and your cooperation. Thank you so much for supporting this channel. As always, if you like these types of educational content, please consider smashing that subscribe button, like and share these videos, and drop your comments below. So today I am coming to you with a skill transferring a resident into a wheelchair. So this is one of the common skill that is given by the State Board for the CNA students. So I will walk you through the steps, and if you hit on each one of these elements, you are guaranteed to pass this skill. So the first thing you want to do is to wash your hands. According to the Center of Disease Control and Prevention, CDC, we are supposed to wash our hands 15 to 20 minutes to minimize the, actually 15 to 20 seconds to minimize the transmission of any type of infections. So the next element is that you gather all supplies for the skill. So what skill are you doing? You're doing transferring. So you gather the wheelchair, you gather the gait belt, you gather the non-skid shoes, the non-skid socks, all of that. You introduce yourself to the patient, tell them your name, and then you want to explain to the resident what you are going to do, what skill you're going to perform. That way you can minimize the anxiety of the patient. Place the wheelchair next to the resident bed before assisting resident to sit at the edge of bed. That's important. You want to position the chair at a certain angle. The sixth element is that you move the wheelchair footrest out of the way before standing the resident for transfer. We know we always have to move that footrest because the patient can, their legs can get tangled and they can fall. Then that's why we have to remove the footrest out of the way. The seventh component is that you place an unskid footwear on the resident before standing the resident for transfer. That way for safety, prevent falling. The eighth element is that you provide support to assist resident to a sitting position on side of bed without pulling resident by lower arms. The ninth component is provide resident time to sit on the side of the bed to adjust to change in position before transferring. This one is very important, guys, because when you're getting a patient from a lying to a sitting position, their blood pressure can drop, and that's called orthostatic hypotension. Their blood pressure can drop, and that can predispose them to falling. So you have to let them stabilize themselves by sitting. The 10th component is that position residents' feet flat on the floor before standing to begin transfer. Let their feet dangle on the floor. The 11th component of this skill is that you prepare for transfer by positioning wheelchair with front wheel close to bed so the transfer can be completed as a pivot. The 12th component that is important, lock. Lock wheelchair before standing resident to begin the transfer. This is a safety issue, and this is very important. They always look if you're locking the wheelchair for safety. The 13th component, apply a transfer gait belt before standing resident, placing it around the resident waist and over clothing. That's important. You don't place the transfer belt on the bare skin. Place it over the patient waist, over clothing. That's important. That's also a very important concept to remember. The 14th element is that you provide cues to the resident before assisting to stand. Let the resident know that you're getting ready to stand them so they could be mentally prepared. The 15th component is that stand in front of resident, reaching under resident's arm to hold transfer gait belt at the sides or around the back through the transfer. Stand in front of resident, reaching under the resident's arm to hold transfer gait belt at sides or around the back through the transfer. This is important to know also. The 16 component is that brace one or both of residents' legs during the transfer while assisting to stand, turn, and sit. 17th element, maintain own body mechanics when assisting resident to stand, turn, and sit. The 18th component of this skill is that transfer resident as a pivot, completed without having resident take steps to reach wheelchair. And before assisting to sit in a wheelchair, position with the back of resident legs against the seat of the wheelchair. This is important to know. The 19th component is that you support resident to provide for controlled, gentle lowering into the seat of the wheelchair. The 20 component of this skill, support resident to provide for controlled, gentle lowering into seat of wheelchair. 21 element of this skill, leave resident position in wheelchair in proper body alignment. Make sure they're not in a slouch position. Make sure they're in an upright position. Then you want to remove the gait belt. Remove the gait belt when transfer is completed. That's important. You don't leave them with the gait belt on. You have to remove the gait belt. So transferring a resident into a wheelchair, these are some of the other 23rd component. Did you ask about preference during care? That's very important to know. You have to ask about patient's preference during care. So what are some things that you may ask about residents' preference during care? You should know some of these skills because you were taught some of these skills. Then you want to use standard precaution and infection control measures when providing care. End the skill with your hands clean. Wash your hands. Remove gloves. Wash your hands. Refrain from touching resident before hands are clean. That's infection control. That's important. Ask about comfort during care or before care is completed. Promote resident rights during care. What do? Announce yourself. Knock before entering the patient's room. Refrain from addressing resident using terms other than his name. You don't call a patient honey and darling and all of that. That is inappropriate. That is unprofessional. Call the patient by their name. Promote resident safety during care. How do you promote safety? You leave the call lights within close reach at the end of the scale. Leave the bed in the lowest position at the end of the scale. Leave all personal belongings close within the patient reach. That's how you promote patient safety. So guys, this is it for this video. I hope you like this video. I hope it's informative and it can help you to pass your CNA skill. For all the CNA sisters that are taking this skill, try to implement some of these strategies and it can really help you to pass the skill. Again, if you like these types of content and these types of material, please consider liking, sharing, and subscribing to this YouTube channel. Thank you so much for watching and I'll catch you in the other one. Bye for now.